Today we have with us Mana Modares, who is a radiology resident who is on the path to becoming a radiologist.
Just enjoy the ride, enjoy learning, even though we all want to be perfect 100% of the time. It's really important to realize that this is the time to make mistakes. This is the time to ask questions. This is the time to, struggle.
You grew up with your mom being a radiologist, initially in Iran, and then she adapted here. Did that make it easy for you, or did that put too much pressure on you?
Never met an unhappy radiologist.
There you go.
Put that plug in.
Absolutely. So Mona, first things first, why radiology?
Oh, wow. This is taking me back to my CARMS interview.
Absolutely, yeah. It seems like an exact question they'd ask you.
Yeah, it actually seems like it actually happened.
But we don't want the interview answer. We want the real answer this time.
Oh, the real answer, the unfiltered director's cut. Why radiology? So I think the biggest thing about radiology that I really fell in love with was how much you have to know. I feel like it really keeps you on your toes and you are able to really help your colleagues. I think you're such a valuable part of every team, even though you're more in the background and maybe not everyone thinks about you all the time and you're not present all the time, but you're always working in the background. And I think hospitals, patients, colleagues, everyone relies on you. And I think
you're not making it enticing to medical students at all.
Come.
You're saying that you need to know a lot.
Yes.
You need to be helping people a lot.
Yes.
But you're going to be behind the scenes always.
Well, let me see. The first question they ask you when you get into medical school is, why do you want to be a doctor?
Absolutely.
And isn't the interview answer, I want to help people?
Fair enough.
So I know it sounds like it's a lot. And for me, it did sound a little overwhelming to hear about all of these things. But at the same time, you want your training to be interesting. You want to be learning. You don't want to be stagnant. And I think we sometimes maybe get into medical school and then we're like, I got in, it's over, it's done, like I'm good. But honestly, you get that way a little bit and you're kind of, complacent and whatever, and you're enjoying it. But then after a while, you're like, okay, my type A personality needs something. And I feel like, it's the same thing with residency. It's like you get in, you're like, I matched, amazing. But then after a while you start getting restless again. We're all type A. Yeah.
That's the classic feature of radiologists in which we all want to be challenged and we all have problem solving. And to point that out, so let's say that you're on any other specialty.
Yeah.
Diseases do evolve. There's more treatment and stuff identified. However, nothing has evolved as much as medical imaging because the technology evolves so fast. And then we're trying to keep up with what we are able to see.
Yeah.
And not only that, now we have nuclear medicine just exploding with number of radiopharmaceuticals. Yeah. And we also have theranostics. So, if you want to be challenged, if you want to always know more, know a lot, be kept on your toes, you're absolutely right. Radiology is the field for you.
For sure.
But did you know all about radiology when you were doing your med school?
So I didn't actually know that much about radiology. So full disclosure, my mom's a radiologist.
Your mom's a radiologist?
Yeah.
There you go. So you knew, you had the inside scoop.
So I knew she was a radiologist, but that's it.
Okay.
So I didn't actually really know exactly what she did.
That is interesting. So what did she tell you she did? She just went in, locked herself in a dark room and she's like, see you later.
So I think she kind of gave me the answer that I think now I give to people when they kind of ask me what I do. And it's like, I look at images or I read images or I interpret images, and everyone kind of goes like, oh, is that like x-rays? Like, do you do x-rays? And I'm like, well, I read x-rays, I read CTs, I read MRs, I read ultrasounds, but that's kind of where it ends. And I think that's kind of what I had in my head as well, was just, you look at pictures all day, like, okay.
Did you see her at work scrolling through pictures?
Yeah. So I actually got to see, what was it when they used to put the images up on that board that lit up?
Oh, wow.
What's that called?
The residents now don't know what a view box is.
Yes, that.
Oh my God. It was literally called, like, in clinical side, you would have bedside teaching. this was literally called viewbox teaching, in which they put up an image and they'll teach you at the side of a viewbox. That was the radiology equivalent of bedside teaching. And you don't know what a viewbox is.
Well,
That's
I was
amazing.
getting that when I was a kid. I was getting that kind of teaching. I just
Oh,
didn't know what it was called.
so that's where you're taught, okay, A for apple.
Yeah.
Yeah, yeah, viewbox, take the next one. Oh, that's
Yeah.
amazing. Okay. So you were able to see across generations of
Yeah.
radiology because back when your mom trained, probably things were quite different, right?
Yeah, for sure.
And can you think of any other large differences between radiology in your mom's time versus now?
Well, the difference is that my mom also trained in Iran at first. So I
Okay.
think that's also, of course, like different in terms of, how they practice radiology versus here.
Uh-huh.
I do recall her telling me that she used to do a lot of like ultrasound and sonography herself as well.
Yes.
So yeah, that's something that's common there as well. So I think here it's, of course, there's PACS, there's so much technology, and the field is just growing at such a rapid rate that I think it's so hard to even compare it to then. But
She's
you
probably
know,
forgotten how life was because it's
I
changed so
know.
much.
It's so insane how much she's had to adapt. For
Yeah.
me, I haven't had to adapt much. Like I just came into radiology and we were already on PACS.
Yeah.
And I think that was the time when they were talking about AI at first and everyone was like, "Ooh, you don't want to go into radiology. Robots are going to do radiology."
Are you worried?
No. Are you worried?
Not really. I do think that AI is going to help our jobs a lot.
Yeah.
To a certain extent, it will decrease the necessity for the number of radiologists doing a lot of tedious jobs.
Yeah.
But yeah, like we would still need a whole bunch of radiologists, at least in my lifetime. But a day would come, and if a day comes that we are all replaced, I'd be the happiest person because it means that someone else is doing a better job than us, and that's absolutely great. But I don't anticipate that based on what we see
Yeah.
changing that
Exactly.
quickly.
Yeah, no, I agree. I don't think robots are going to replace radiologists, just like they're not going to replace any other specialties, right?
Yeah. So, what do you think are the challenges of being a radiology resident? If you think that AI is not the challenge, what else is?
So I think a huge shock as a radiology resident was actually how much call we have to do. Full disclosure, we do a lot of call.
Uh-huh.
Also how, again, like how much everyone relies on us on call. I think, of course, we start with our off service year or intern year in the States, where you kind of rotate through other subspecialties or specialties. And on internal medicine or on surgery less so, but internal medicine, sometimes you get some downtime between consults to kind of hang out, chill, eat as a team.
Yep.
But radiology is go, go, go. On a busy night, you're sitting in that chair for 12 hours, answering phone calls, reading scans. You're doing something the whole time, which is nice. Again, going back to that kind of ADD type A personality that we all have. But it was a bit of a shock for me coming from, that off service year into radiology.
That's something which surprises a lot of radiology residents because, as well as a lot of other specialties, because you think and you associate specialties like surgery being extremely tiring
Yeah,
because they're on their feet all the time, they're operating or they're doing something.
of course. Yeah.
However, the amount of mental processing we do just sitting in a seat at the end of the day leaves you completely drained and tired.
Exactly.
And it's kind of very difficult to say because from the outside, it's like you were just sitting there scrolling your mouse. But yeah, it takes out so much.
Thank you. Yes.
That said, it's not just interpreting images, is it? It's a lot of phone calls and pages.
Yeah, you're like flight what is it? Those like those people that like coordinate flights. What are they called? I'm post call.
Controllers.
Yes, yes. Like you're like a control center of like trying to figure out, when this person's gonna come to CT, when this person's gonna go. This
And you're
person has a
preventing
contrast.
crashes.
Yeah, this
That's
person
exactly
has a
what you do.
contrast allergy. There's just so many moving parts that you have to keep track of.
Mhm.
And of course, at the same time, when you're just starting out as a PGY2, you're also trying to learn on the job, which is that in itself is like one of the steepest learning curves that I've ever experienced.
Yes. It is almost trial by fire.
Yes.
But I've heard that over time, the residency program, especially in Toronto, has offered some support for it in which you're now shadowing other senior residents and kind of eased into it a little bit instead of being just thrown into the deep end.
Yeah, no, for sure. There's definitely a lot of supports. Like they help you kind of prepare for call, and they have all these learning courses beforehand and shadowing, of course. So you kind of know what to expect. But as we all know, like sitting in the driver's seat is so much different than sitting in the passenger seat.
Yeah, you can do. I know that there's that emergency simulation which you guys do, which
Yeah.
simulates a call.
Yeah.
But probably the real thing is still, a little bit anxiety inducing the first time you do it with the training wheels off.
For sure. It's kind of like transitioning to becoming a staff, right?
Mm-hmm.
It's like you have your safety net, the whole residency, fellowship, you have someone helping you out. But once you're in the seat by yourself, you're like, oh no.
Yes, you're just doing the same thing, but now without a safety net, and that adds an element of danger. So what do you like now? You are, you're well past the midpoint. You're kind of nearing the end of your residency now. And now you are in a position to mentor and advise the incoming residents who are going through the same fears and anxiety as you were. What advice do you give them in that period when they're starting call?
Yeah, I think the biggest advice is just to be kind to yourself. I think it's so hard for us to not be hard on ourselves when we're not performing to the level that we think we should be performing at, or comparing ourselves to our peers, but maybe not even in an objective way. It's more subjective that we think, I'm not doing this right, everyone else is getting it right, but that's not true. Everyone has their own struggles. And I think another big piece of advice that I have is just remembering that everyone kind of comes from a different background and walks of life. And some people are, for example, they have PhDs when they get into residency and they know a lot more about neuro or body or whatever. And sometimes that can be a bit intimidating when you show up to rounds for the first time and, someone's rattling off neuroanatomy and you're like, was I supposed to study that? And it can be really overwhelming, especially when that comparison comes into play. But I think always remembering that so many others have been through this. They've been through the ups and downs of residency. They've survived, they've thrived. Some people that you may have not even thought would do well have done very well.
Yep.
So I think realizing that, and also realizing that because so many people have done this, a lot of things have happened in the past that have now resulted in better support and more expectations of, how to help you in case anything goes south. So I think just knowing that it'll be okay in the end.
You're going to be okay in the end.
Just enjoy, I know it's so hard to say, but just enjoy the ride, enjoy learning, even though we all want to be perfect 100% of the time. It's really important to realize that this is the time to make mistakes. This is the time to ask questions. This is the time to struggle. And then by the end of it, you'll get to fifth year and you'll review all your notes and be like, now it all makes sense. It's all coming together.
True. You put it amazingly well, because everybody has their own challenges, but in the end, it's all going to be okay.
Exactly.
But speaking about you specifically, what were your challenges? Because you grew up with your mom being a radiologist, initially in Iran, and then she adapted here. Did that make it easy for you, or did that put too much pressure on you?
Well, my mom's also an academic radiologist, so she is involved with the program. So it actually did put a bit more pressure, I think.
Yeah.
I think it's just, again, maybe a lot of it is internalized. It's not so much that she's saying anything or doing anything, but I think we all have this, we want to live up to our parents' expectations. And I think especially if our parents are very well accomplished, the bar is even higher, it feels like.
Exactly.
Even though, I think they're all proud of you no matter what, and they're very proud of the journey that you're on. In your head, you just want to be the best, better, and prove to them that well, for me at least, coming from an immigrant background, I just really want to make sure that in a way it's been worth it, and that I'm showing them that all that they've put in has an output, has an outcome. So I think that in itself also adds some pressure, and maybe some other kids who come from immigrant families can relate to that. But
did your mom ever tell you that, how do you not know this? This is basics. This is Erdheim Chester disease.
Yes.
Or did somebody else say that, your mom published on it, how did you not know it, or something like that?
So no one's ever said that to me, but she has commented on the fact that I should be studying more. It's like, I
Fair enough.
just feel like you should be reading around some of these things. But no, I think she does a pretty good job of not pressuring me too much and not inserting herself too much into my training, because it is, at the end of the day, my own journey. And I think she also has a lot of faith in our program and, and the supports that I have. So
Is that
she
what
knows
we
it'll
talk
be
about?
okay.
Is that what you talk about during dinner? Like radiology stuff?
Definitely not.
Okay. Okay.
I mean, of course, at the end of the day, we all go home and complain sometimes to our partners and our parents and our friends, but no, we definitely don't talk a lot of shop at home.
Oh, that's good to know, because if you go and complain about call, your mom has
Yeah.
a lot more to complain. She's like, "What are you complaining
Yeah,
about?"
which she did. So then that was shut down immediately.
Immediately. That is great. And in terms of life after residency,
Mhm.
how did you decide what you want to do? And how do people generally decide what they want to do after residency?
Well, I think it's pretty common for everyone to do a fellowship after residency, at least in radiology. Maybe some other programs, not so much, but at least in Toronto, everyone does a fellowship after residency. The process is pretty early on, actually. It's like kind of towards the end of third year, which feels like you haven't experienced much of radiology yet.
Especially because the very first year is an internship year in which you're off service more
Yeah.
than in radiology, right?
Yeah, but I think there is good exposure to almost every specialty or subspecialty that you might want to go into for fellowship. And you can always, for example, for our program, I can only speak to it. You can ask the program director to, put certain blocks where you want them to kind of get exposure if you
Okay.
are considering them. So the program's really flexible in that way. And
That's amazing. So they make it
yeah.
flexible. Toronto makes it flexible for you.
Yeah,
That's good.
yeah. So it's really good in that sense. And for me, I decided that I wanted to do body, and the process of applying to fellowship I can't even compare it to medical school or residency. It's so much easier. And I think, at that point when you show up to the interview as well, they know that you've already done all the things that you've done and you're an accomplished person, and feels a lot more relaxed. But yeah, it's really great at the same time to kind of know what subspecialty you'll be going into kind of early on as well. You're kind of like, whew, that's out of the way. Next thing.
That's amazing that you've chosen body.
Yeah, yeah.
I'm biased. I'm an abdominal radiologist, but I can tell you that you chose wisely.
Thank you.
During residency,
Mhm.
do you think that residency consumes all of your time, all of your energy, or do you still manage to have a life outside residency?
I think residency can be pretty all-consuming at times. I think for sure, again, for us, we have a lot of call at the beginning of residency, less call later on. So for sure, I have very little memory of my R2 year because I was mostly on call
Just
and in
went by in a
days.
bus.
But I still managed to have a life. I still recall going on trips, seeing friends, family. No one was like, "We haven't seen you in months. Like, where are you?" So you can still manage it. Of course, it's tough.
Yeah.
But I think as you go through residency and also as you become more used to the flow of residency, it becomes a lot easier to balance your time, and time management plays a huge role in that. Of course, the better you are at managing your time, the better you'll be at kind of balancing the things that matter to you, and priorities really come into play. But of course, I think everyone who's gone through medical training can relate to missing things that you've wanted to be a part of because of other duties and, your call schedule and things that are out of your control. But I think it's very doable. And I think radiology residency is for sure very amenable to having a life outside of residency. So it won't be your whole personality.
It kind of seems like we are preparing you for real life, because that's kind of how it is, right? Once you become an adult, you have to balance work, family, kids, and a whole bunch of stuff. And it's kind of the same thing here, in which you've got to balance call and the day work and keeping up with academics and publishing and applying for fellowships, and then also managing to have a life outside of work. and finding time to be a part-time influencer as well.
We're going to
So
talk about that.
I heard that you have a budding career as an influencer. So
Yes,
yeah.
yes. So I guess we'll do a little plug here. But yeah, me and my best friend, we actually decided to start a TikTok and an Instagram account.
Uh-huh.
We make medical reels, like funny reels. I think it's like a way of kind of, I don't know, using our
Cathartic.
creativity to kind of talk about medicine in a funny way. It's been really fun doing it with her, and now we're sponsored by a water bottle company. So
There you go. If you're a sponsored influencer while doing your residency, how bad can it actually be, right?
exactly.
Yeah. I know that you were trying to be very creative and you got into this, but for people who want to be too academic
Yeah.
or explore other avenues like leadership
hmm
in other things, does the program support you and get you ready for all of this?
Oh, yeah. I mean, it's Toronto. There's tons of opportunity for research, leadership. Like, there's so many. And I think the biggest thing is there's so many different personalities in every hospital that you go to that if you find a staff that you really like or a fellow that you really like and you just want to, do what they're doing and you're like, I love the way you live your life. And how do I become you in the future? You definitely have that opportunity. And we get so many notifications and emails and everything about all the opportunities that is there for us inside the program, outside the program. So there's never been any issues with getting involved with different things. And because it's such a big program, we have so many different things that we need, right? Like we have all sorts of committees and representatives and RPCs and meetings. So if you want to fill up your time with leadership and research and not do dancing on TikTok, that's fine too.
Hey, everybody has their preference.
Maybe I can get some academic days for that.
That's what you should speak to your group when you're applying for a job. Hey, can I get time for that?
yeah.
Oh, that's perfect. But given that, like I know that your peers probably are doing academics, some are doing
Yeah.
research and stuff. Is there like competition? How is the culture among the residents? And also, in addition, is there any fear of missing out in which you always feel like, oh, he's doing this, I should be doing that as well, and you feel pressured
Yeah.
into or pulled in different directions?
Yeah, so I think again, because our program is so big, there's so many different personalities and people that I don't really feel that, we're competing with one another because everyone has kind of different interests. Again, applying for fellowships, for example, is, maybe something that's competitive or something that you're doing at the same time as your peers, but it felt like it was a very easy process in terms of, we're all very accomplished people. The program supports us. We have our staff that have mentored us or have been doing research with us. And there's so many people in our program that it didn't feel like we were fighting for spots or anything like that. So it was very much collegial. Now we're studying for our Royal College. We have our study group. So it's
Mm-hmm.
very much let's get through this together rather than competing with one another. I feel that there is such an abundance of opportunities. Again, you do sometimes fall into that trap of comparing yourself to another person and being like, am I doing enough? Am I not doing enough? But it's just important to realize that you're on your own journey and you're going to become your own kind of radiologist that you want to be. You don't have to become this other person's type of radiologist.
Which is great because I think, as you pointed out, there are so many personalities. So there
yeah.
are so many different role models for you to mimic.
Yeah.
You could choose any one of them who you closely identify with and then choose to kind of mimic some of their the way they do things, and there's just so much to learn about. Or you can just choose the best parts of a lot of people and then put together and be your own
Yeah.
person, which is absolutely great.
And
But
medicine is such a people interacting or people. Well, for us, we're interacting with our colleagues most of the time, but
mhm,
also patient facing. And it's so important to have those different personalities and different types of people because some people, vibe with a certain type of person. So I think it's important to just realize that you always do bring something to the table. Maybe it's not the same as someone else, but you have something to offer too.
absolutely. So essentially, there was a lot to do at work, academics, research, leadership, and all of that. And you still managed to get some time out. But did you get to enjoy the city as well? Like, did you grow up in Toronto, and
I
and
did, yeah.
did you choose Toronto because you wanted to stay here?
Yeah. So, I mean, I went away for my undergrad. I went to Western, so I lived in London for a little bit,
And
and
then
then
you
I
were like,
came
nope, and
back.
came back.
Yeah, it's like, and then I'm like, that's enough.
Uh-huh.
And I came back to Toronto. I definitely wanted to live downtown. So I grew up in North York,
Hmm.
classic. But yeah, I wanted to live downtown. I wanted to experience downtown life in my 20s. And it was so fun.
Hmm.
Still is. I still have a lot of fun here. The food scene is incredible, of course. So I love Toronto. Toronto's home, and I love being here. I am gonna go take a little break for fellowship, but then I'll be back.
You'll be okay. You will be back. Yeah,
A
that's
little
that's
intermission.
that's Toronto for you. You can try and go out, but they always come right
Yeah,
back.
yeah.
And how was training here in Toronto, especially
Mhm.
as like women in radiology? Was
Yeah.
there any initial like at least fear or anxiety you had, especially because the name of the specialty is radiology and it has radiation in it, and
Hmm.
we've had this discussion that sometimes women may be discouraged from taking it just because of the negative connotations associated with radiation. Did you have any worry? And how is the residency program? Is it evenly mixed, or do you find other people having similar concerns?
Yeah, so I mean, for me, my role model was a woman in radiology.
There you
So
go.
I
That's an easy.
wasn't even really thinking about, whether it's a male-dominated field or not. Apparently, historically, it is.
Hmm.
Right now in the residency program, if you look, you can't tell at all. I actually think there might be more girls in the program at
Ooh,
this
you guys are
point.
taking
Yeah.
over
Well, we're taking over in most spaces, yes.
the world. Yeah, might be a better place.
Yeah,
Go
I,
on.
I agree. I'm biased, but I agree. But yeah, I think, for sure there is that radiation, maybe concern. But I think that other than interventional procedures and fluoroscopy and,
Mhm.
being exposed in that sense, you're not really exposed much to radiation in radiology. We're mostly in our reading rooms.
Mhm.
But in that sense as well, of course, if there is, a particular concern or case by case basis, you can always talk to the program, and I'm sure they're very accommodating in those situations. But overall, no, I didn't really find that I was really concerned about that. I actually find IR extremely cool and very fun.
Absolutely. Like the radiation risk is it's much more bigger in our head than what it actually is.
Yeah.
And what are you most looking forward to after your fellowship being a radiologist? You've seen your mom be a radiologist. What are the
Yeah.
stuff which you're looking forward to being a radiologist?
I mean, I'm looking forward to being done. Freedom. I'm looking forward to honestly just taking a little break and reflecting on my accomplishments and all that I've done.
It's amazing.
I
You're
want
gonna take
to,
a delayed gap year after your
yeah.
fellowship and kind of go around, go to Thailand
Yeah,
maybe.
find myself,
Yeah.
eat, pray, love. No, but actually, I think it's important to always not be on the go, go, go. I think I will take a little break, reconnect with my family and friends, thank them for putting up with me for as long as they have. And I'm going to celebrate. But then after that, I think, I really look forward to finally working as a radiologist. I think that's what we're all waiting for. And I think for me, seeing my mom, the light at the end of the tunnel is right there. And I see it and I'm like, it's happening. And I'm excited for it. And I see again how much value she brings to her colleagues and her patients. And I'm just so excited to be a part of that and to do that for the rest of my life. It's an awesome job.
It's
Never met an unhappy radiologist.
there you
I'll
go.
put that plug in.
Absolutely. Like it's one of the most fulfilling and satisfying specialties
Definitely.
ever, which also gives a remarkable flexibility as to what direction you want to pursue in
Hmm.
terms of multiple avenues being community versus academic or different specialties
Yeah.
or diagnostic versus interventional. So it gives you so much flexibility as well as the flexibility to be in control of your own shifts when you want to do
Hmm.
them, and to a small extent you could also work from home at certain points of time because it's all packs. So that way
Exactly.
it's such a remarkable specialty uh, to have people in, and it is often overlooked,
Yeah.
which is kind of great because it's like a hidden gem and not a lot of people find it. You'll find it only if you're actively looking for it.
For sure. I mean, even growing up with a radiologist, I didn't know half of these things. So it's definitely something that you have to go actively seek and have to make an effort towards as a medical student, I find. And, maybe just seeking these kinds of, podcasts or interviews or talking to radiologists yourself, I think it's really important.
And what other advice would you give for medical students who, either don't know about the specialty or who know about the specialty and they're still, on the fence about deciding? What would you tell them?
Yeah, I think as a medical student, it's really important to explore. I think it's the time to definitely explore all avenues. I think don't let stereotypes get in the way also of your exploration. Don't let Grey's Anatomy dictate your future career. We all learn the hard way.
True. This is what I heard because most medical dramas, for example, if you take Scrubs, the radiologist would be like somebody who's just like some weird person in the basement. He's just coming out and saying, my machines, something like that. In reality,
Grey's Anatomy had one radiologist. We saw him like once. One radiologist for the entire department.
And I actually say that like our life is much more like Dr. House, in which we are probably solving a lot of puzzles every day, in which we link clinical details with imaging together and put together to form the final diagnosis.
Yeah, but it's nicer and less, concerning in terms of our personality.
Absolutely. Without rubbing it in the patient's face. We just, in our own silent world, we write the report and then we're happy with that.
For sure. Yeah, I think that's really important to just not let stereotypes get in the way. Radiologists are not sitting in a basement somewhere. We're not weird. We're very nice. We're very normal. And I think it's important to ask a lot of questions. And I think it's also really important to not think about the now, because we're not always going to be 20 and, vivacious. Someday we're going to be 60, we're going to be 70 and
still vivacious.
Yeah, and still vivacious in our own way. But, doctors tend to work their whole lives pretty much. Yeah. And I think it's something that you should consider as, do I see myself doing this when I'm older, when I have kids, when I have grandkids? There's a lot of things to consider in this very, very long road that you're going to be on. So I think it's definitely important to explore as much as you can and to talk to radiologists, because they're all happy and they're all going to advocate for their specialty. And we need more radiologists.
That is true. And let's say that the medical student has now decided to do radiology residency and they're looking for where to do it. How would you advise they go about it?
So I think a lot of, in terms of where you want to train, is dictated by where you're from, where your family's from, where your partner's from. So that definitely plays a role. But I think if you are, a free soul who can go wherever they want to, it's really important to also think about your future practice. I think, if you like being in a rural setting, if you want to be kind of on your own, if you want to experience that kind of radiology, of course, there's tons of programs in that situation. If you want to be somewhere where you're exposed to every single kind of pathology and every kind of person from all over the world, then Toronto's the place for you. And I think the training that you get here, just in terms of the patient population and each hospital having its own flavor and all the staff that you're exposed to, not only in radiology, but in every specialty, I think you will have the most enriching training that will take you anywhere that you want in the world.
That's amazing. So the fundamental difference is that all medical schools for radiology residency, they're pretty good. They offer their own menu.
Yeah, of course.
However, Toronto is like this huge, lavish buffet in Caesar's Palace in Las Vegas. It has everything possible.
Definitely.
You might not be able to eat and savor everything, but you can pick and choose what you like. And I think that's the best part about Toronto.
Definitely. Well, and the food, the actual food.
The actual food as well. Yeah.
You try to eat as much as you can.
Yeah, just enjoy radiology and enjoy the food. And Toronto's the place to be.
Definitely.
Mana, it's been a pleasure to have you here. And hopefully you've inspired a lot of medical students to either become radiologists or to kind of become influencers in either TikTok or Instagram in their own right. And that way they can be sponsored as well, because I don't think that any radiologists are sponsored, the commonest joke about radiologists is that we always have to have this disclosure slide in every presentation. And we always say there's nothing to disclose.
Oh, I'm going to have to disclose it.
Absolutely. You'll be the first person to say that you're disclosing your affiliation with this.
If you see me drinking this water bottle, I'm sorry. I have to disclose that I am sponsored.
Absolutely. If you found any of this interesting or even remotely entertaining, make sure to support us by subscribing. And see you on the next one.